Hello and welcome. That song there was Landslide by Fleetwood Mac or the Dixie Chicks. Both I really like. In today's video, I'm going to describe further about my path to physical therapy. And we have a feature from Cosmo. There she is. That's Cosmo. Anyways, I grew up playing sports, all sports, and I started to take basketball a lot more seriously. So I joined a club team and everything like that. In 8th grade, I was in California for a tournament, and I dislocated my shoulder in the championship game, unfortunately. When I fell on the floor and rolled, it went back into place. Didn't really think anything of it. It was a little achy, that was it. So when I come back to Arizona, we don't go see the doctor or anything because we really don't know what exactly happened. Anyways, a few months later, in a 3-on-3 tournament, same thing happens again. Dislocate my shoulder. This time it's a full subluxation, and it doesn't go back into place. So it's really painful, and we go to the hospital. They have to put me under to put it back into place. Anyways, after that, we go see a doctor. They say, can try conservative treatment first. We'll go from there. Go ahead and try physical therapy. It seems to be working well. And then I dislocate again. And that's in the spring. And at that point, we go see my doctor, and he says we should do surgery. So in the summer, 8th grade, I believe, 2007, I had my first shoulder surgery to repair a torn labrum from dislocating. Do the surgery, go back to physical therapy. At this point, I'm getting pretty familiar there. I'm starting to know the PTs besides my own that I see. And, rehab goes well, get cleared, go back to sport, happens again. Now I've had 4 dislocations. I'm 14 years old. I've already had a surgery. This isn't looking good. Don't remember exactly how things went, but I think at that point, because I dislocated again, we went ahead and just scheduled another surgery. So at that point, I was having my second surgery for a torn labrum, same shoulder, same everything. This time we were going to try tightening the capsule a little bit more. To my knowledge, I haven't ever gone back and read the doctor's notes. He used the pec muscle and pulled it over a little bit more to tighten it in the front. And then we also tried doing I believe it was a plasma, some kind of blood injection to try and further healing and everything of that sort. Needless to say, it goes well. I remember specifically having my 2-year dislocation-free anniversary in high school. It was my second surgery was my freshman year of high school. In my junior year of high school, I remember going out to the softball fields, and it was around prom season, and I see a dozen roses in the softball dugout, and there's only maybe 5 or 6 of us, juniors, seniors on the team. Some of them have already been asked, and so everyone's like, "Oh my gosh, Michelle, you're getting asked to prom. You're getting asked to prom." And so I'm super excited. I open up the card, And it's just a really sweet card from my dad saying congratulations on 2 years free of dislocations. And that was a really big moment for me, because that's about the longest it's been without a dislocation since then. So I still look back on that and appreciate my dad doing that. I didn't know I'd get emotional. But anyways, after that, obviously, I was like, wow, it's been 2 years free. I think this surgery really worked. I'm going to try and play basketball. I just want to play basketball for my senior year of high school, because at this point in my junior year, after my second surgery, my doctor had said, no more basketball whatsoever. It's too dangerous. And it was, you could play softball if you just monitor, no head diving or anything like that. But I missed basketball. It was my love. So I went ahead and started going to open gyms in preparation for trying out for the basketball team. And sure enough, it dislocates again. And this time it dislocates kind of in a different manner. So the way I knew how to put it back in myself wasn't working. So I had to go back to the hospital. They had to put me under, put it back in place. And the doctor once again was like, got to do another surgery. So I had one more surgery, making it 3 total by the time I'm 18 before I graduate high school. This entire time I kept going back to the same physical therapist, and she was a sweetheart. She made me feel better, especially because, my identity at that time was an athlete. I was a basketball player. I played softball on the side. And those were getting stripped out from under me because of this injury that kept happening. And she always saw the positive in everything, and kind of helped me figure out what I want to do, because I was thinking, wow, now I'm a senior. My life had been athletics. It was planned college with a plan to coach professionally at some level after that. I never thought of what else do I enjoy doing. And she turned me on to physical therapy because of how great she was. And, I don't blame her for my recurrent injuries. That was just my body makeup and the life I was trying to live. She was great. She, made me get strong. She checked everything thoroughly, especially knowing that I was a recurrent dislocator. But anyways, after high school, went into college, was doing pretty good for a while, but it started happening where I would dislocate roughly once a season. I called myself a seasonal dislocator, so 4 times a year. And I didn't think anything of it, because at this point I know how to reduce it, and it's not painful. So it's something I just kind of deal with. My doctor, I had to follow up with him a few years into college just to make sure, since the, dislocations, there wasn't anything wrong in the shoulder. And there wasn't, but he did mention the Latarjet procedure and how if I wanted to, I could get that done. But for me, I'm okay with how things are now. I'm about to graduate physical therapy school in December, and I've made it through that, my clinical rotations. I've learned how to work with my shoulder, and I think that's something that's really important. I didn't let it stop me from then finding and creating my new dream, which was physical therapy. And that's important. And I carry that with me into my practice, because I know how traumatizing an injury can be, even if it's to the weekend warrior who has an ankle sprain. Everyone handles it differently, but it's how you take your injury and cope with it and make you still live a happy life. And although I get emotional talking about mine, I've come to terms with it, and I wouldn't trade it for the world, because had I not injured my shoulder, I wouldn't be a physical therapist. I know that 100%. And because of my physiotherapist who I went to, I have always aspired to be like her and to be as passionate and compassionate about every patient I see, no matter what setting I'm in. And that means the world to me. So thank you, Tracy. I doubt she would ever see this, but yeah, that's my story. Also, that song at the beginning, Landslide by the Dixie Chicks. If you can't tell, definitely a country music fan. So you'll be seeing more country music songs at the beginning of my videos. Don't forget to subscribe so you can stay up to date on my videos.